Chapter: Prescriptions. Key terms. Role of the pharmacy technician. Assisting the pharmacist in receiving, processing and filling prescriptions, inventory control, providing and maintaining patient confidentiality, and referring patients to the pharmacist. Extemporaneous compounding is the on-demand preparation of a drug product, according to a physician's prescription, formula, or recipe. OTC drugs are medications that do not require a prescription, but may be filled with prescriptions. Prescription is an instruction from a medical practitioner that authorizes a patient to be issued a drug or medical device. Signa or SIG indicates the directions for use, and the administration route must be translated for the patient. DAW or dispense is written. A code specifying that the brand name drug, rather than its generic equivalent, is to be dispensed. Schedule II drugs. Drugs that have a high potential for abuse or addiction, but also have safe and accepted medical uses. They require special handling. HIPAA, Health Insurance Portability and Accountability Act. A federal act that protects the privacy of individuals and the sharing of protected health information. Protected Health Information or PHI. Any personal information that could be used to identify an individual or their health history. Auxiliary labels. Labels regarding specific warnings, food or medications to avoid, potential side effects, and other cautionary interactions. High alert medication. Medications that are known to cause significant harm if an error is made. Tall man lettering. Uppercase letters, used within a drug name, to highlight differences between look-alike drug names. Days supply. The number of days the prescribed quantity of medication will last, when taken as directed. Key concepts. A prescription is a written or verbal order from a practitioner for the preparation and administration of a medicine or a device. Medical doctors or MDs, doctors of osteopathy or DOS, dentists or DDSs, and veterinarians or DVMs are the primary practitioners who write prescriptions. Podiatrists or DPMs, and optometrists or ODs are also given prescription writing privileges. All practitioners must write within their respective scope of their practice. In many states, nurse practitioners and physician assistants are also allowed some rights to prescribe medications. In community pharmacies, pharmacy technicians generally receive the prescriptions, collect patient data with correct spelling of name, address, allergies, insurance information, etc., and enter into a computerized prescription system. In hospital or institutional pharmacies, the pharmacy technician receives the medication orders, but has no contact with the patient per se. The focus is shifted to making sure the nursing staff are supported and receive the proper medications for their patients. Nursing staff generally administer medications to patients. Abbreviations are commonly used on prescriptions. Pharmacy technicians must know these common abbreviations and be aware of errors that can occur due to their misinterpretation. The pharmacist should be consulted on all OTC and prescription medications. Many computerized prescription systems will automatically indicate which auxiliary labels to use with each drug. Always place the label on the container so that it is straight, uncreased, and fully attached. Technicians must request the advice of the pharmacist whenever clinical judgment is required. A prescription information safety checklist can be a useful tool to help prevent prescription filling errors. Once the prescription and third-party billing is confirmed by the online computer system, the label and receipt are printed, and the prescription is prepared. Since the patient is expected to self-administer the medication, the label's directions for use must be clear, unambiguous, and concise. The day's supply of the medication must be calculated based on the drug quantity and directions for use. Pharmacists must provide counseling to patients on all new prescriptions and on any refilled prescriptions where clarification is required. A patient may refuse counseling. Pharmacy abbreviations are often based on Latin words and use Roman numerals for numbers. Once the prescription is entered into the computer, then drug to disease, and drug to allergy information is automatically checked by the pharmacy software. If third-party billing is involved, this is done online, simultaneously. The pharmacy technician plays a key role in preventing and identifying potential medication errors at every step of the prescription filling and dispensing process. Being aware of potential sources of errors and keeping up with online tools, such as those provided by the FDA and ISMP, are key in error prevention. The fill process. A prescription is generated and submitted to the pharmacy, either physically or sent electronically via fax, email, or telephone. A technician enters patient information, which includes patient name, address, telephone, date of birth, allergies, insurance/billing information, and the prescriber's name. Prescription information is entered into the computer system, generally scanned in, or entered manually. Insurance and billing information is processed. After billing is confirmed, a label and receipt is generated. The prescription is prepared and set aside for the pharmacist's final check. Completed and checked prescriptions are set aside for pickup and sorted alphabetically by patient's last name. Counseling is provided upon prescription pickup, when not refused by patient.